Hello and welcome to the Medical Ancillary Sales Podcast. I'm your host, Michael Berg, and today we have an extra special episode because we have Viv Hudson out on assignment. Viv, how you doing today?
I am great. I'm in sunny Colorado, and I'm actually sitting in the office of Meridrug, which is our latest pathology provider, with Blaine Armstrong.
Blaine Huff.
Oh, Huff.
That's good.
Sorry.
I could be
Huff.
Armstrong.
Okay, I don't know why I thought that, but anyway.
That's fine.
So we want to just talk a little bit about your solution. So welcome to the show, Blaine.
Thank you. Glad to be here. I appreciate it. And Mike, thanks for your time too on this. And I would love to talk to you guys a little bit more about the pathology side of Ameridrug Pathology. Real quick, Ameridrug Pathology is any biopsies from a doctor nationwide that we can get off the skin or internally of the body that's cancerous. It could be from a dermatologist, a urologist, a podiatrist, and the GI doctors, which is gastrointestinal. So anything that's off of a body that we can try to grab off that person and bring it to our lab to do testing on it, that's what we're trying to do. We're trying to test it and read it for the doctor and give him a report so he can make sure that it is not melanoma or any other kind of cancerous cell.
Hey, Blaine, can you kind of maybe give us an idea of what the current climate is for pathology? Because I'll tell you, most people out there, most of the reps who are listening to this have never done anything with pathology. If they've done anything in lab, it's tox and pharmacogenetics. That's pretty much it. So I know you mentioned the types of physicians that go for this, but are physicians pretty loyal to the labs? Do they switch labs a lot? Is there a lot of money to be made in pathology? I just gave you about 100 questions, but
that's a good question. Pathology is on the rise. There's not very many labs nationwide compared to toxicology labs. Toxicology labs, there's over 3,000 nationwide, and probably rising now. On pathology, there's only 800. So pathology is a medical necessity that is provided for the doctor or given to the doctor so we can do a biopsy on that specimen because it needs to be tested to make sure it's toxicology is different for a doctor's point of view compared to a medical necessity because it needs to be done. And it's paid by the insurances 99.9% of the time. Okay. If you're sometimes in their network, if you're not, that's going to be a problem. But on this, guys, is nationwide. Doctors, some doctors you're going to run into that might have their own lab in-house, and they might have it downstairs or have a pathologist on hand. But we can still go after those doctors to see if we can do their overflow. If they're too busy and they can't get it done or they're taking weeks to get it done, they can send it to Ameridrug Pathology, and we can do it within 72 hours. So we're trying to help the doctor out there to make it a faster turnaround time and make it easier for the patients that we don't overbill the patient's insurances. So getting back to some of the questions that you were asking, it's great to have pathology because there's a lot of competition. There always will be. It just depends on that rep's point of view, going in and talking to the doctor, asking them what we can do that's a better service than the other labs. Our biggest thing is faster turnaround time. And we have one of the best pathologists nationwide that's well known throughout the universities, Dr. Gianni. He is very, very well known. So some doctors know him and some doctors don't. So I hope I answer that question. Mike, if you can ask me any more, I'll be more than happy to answer for you.
So what kind of specialties would you target with your solution?
The biggest one, that's a really good question. I would go after the ones that come, we're trying to go after, we want more specimens. So dermatology is a real good one. Urology is good and GI is good because they take more than one biopsy per patient. They usually get between 1 and 3 biopsies per patient on dermatology. Urology is between 1 and 5, and GI doctors are between 1 and 10. So the more specimens that we can grab or biopsies off of a patient, each one of those are billable. Each one of those are billable at between $350 to $550 reimbursement. So, and it could go up a little higher. It just depends on our pathologist, what he wants to read and bill out for. So each one of those, if it adds up, if you're doing one or three, it could be up to $1,500 for one patient. It could go up to $3,000 or $4,000 per patient on reimbursement.
Right.
What is
So,
let me
go,
just interrupt you.
go,
I'm
Mark.
sorry, Viv. What is typical for a physician? I know it depends on specialty. Let's just take a couple of those specialties. How many specimens would you expect to see come in a month from, say, a dermatologist, urologist, and an OBGYN? What would you expect to see?
You bet. Most people see about maybe 20 to 40 patients a day, and you take about 35% of those to start seeing specimens coming in, maybe more, or biopsies coming off of those. Some of them are reoccurring, patients that come in and do a follow-up. I would say between, let's just say a day, I would definitely say 10 to 15 specimens a day. If there's 20 days out of the month, let's just say 20 specimens a day times 20. That's 400 specimens a month from probably one dermatologist. We have a dermatologist here in Colorado that we use or uses us, and he does 500 a month. So, and then the other ones maybe do 100 to 150 a month. It just depends on how many patients they actually see and how many biopsies they pull off of each person.
Right. So, what are some of the challenges that you see, like with getting an office up and running? Because often we find with our solutions, doctors go, "Yes, that's great. Like we'll sign up," and then it's almost like having to sign them up again.
Yes.
To get them to start utilizing the solution. So, does that happen with pathology as well?
Not toxicology is. I don't mean to talk about toxicology, but toxicology is like that. Pathology, if they're going to switch, they're going to switch because of the pathologist that we have in hand. So. Sometimes it takes a little time. It takes that sales guy to go back maybe once or twice and find out why they're not using us or why have they switched over. But usually when it comes to the pathologist, if they're not happy, it's kind of like any other services that are out there. If they're not happy with you, that's a good end for us. If they are happy, it's going to be a hard sell to try to figure out why they want to switch over to us and why it's not because we're better than the other labs. All labs test the same. We all test the same. It's just the people it's going to be the sales reps that actually get the client to switch over. And the doctor might be a little bit upset with the pathologist because of they might be feuding with each other because they're going back and forth with each other's results. And I could put that in a political way. I think sometimes doctors don't like pathologists, and sometimes the pathologists don't like the doctors, and they have a conflict. So, and I think that with our pathologist, Dr. G, I call him Dr. G for short. He is very, very well maintained and has been through this service in pathologist for a long time, over 20 years. So he knows how to talk to these guys as a customer service level,
right?
Is what they want. So I hope I answered that one right.
Right.
Okay.
So as far as when you're talking to doctors about getting them to switch to your pathology solution, essentially it's the pathologist that you have on hand that makes a difference, plus your quick turnaround time. So is there anything else?
There's not much really else that I know a lot of labs are getting in trouble these days for overbilling patients' insurance, and pathologists are billing out more than they really supposed to. We want to make sure that our patients are happy and our doctors are happy, and our pathologist only bills out for what he needs to bill out for.
Right.
And that's, in a nutshell, there's only really 3 bullet points, and that's 72-hour turnaround time after we receive the specimen here. The pathologist that we have in hand, that's nationwide known, and we don't overbill patients' insurance.
Right. So what would be your conversation opener when you're talking to a doctor about pathology?
Well, it's a good question. You put me on the spot there. Haven't been in sales for a while, but long story short, some sales guys can go in and they can just, it's hard to even get in the front door sometimes in any kind of service with clinics and hospitals these days. What makes this a little bit different, if they can get inside around the guard dogs and to the right person that makes the decisions, you only have maybe 3 to 5 minutes to talk to these people and try to get them in hand to say, hey, I know you guys are busy, or I know you guys get hounded every day about a lab or a pathology lab coming in, but how can we help you better your services or your your line of work to make it a lot more efficient for you guys to get results? Or if you have a lab already in place, can we help you out in doing the overflow? Like I said before, it's going to be really up to the sales rep or whomever is going to be going into the doctor's office trying to get in. It's a hard sell. Anything's hard these days, but if it's the rep that knows the doctor or knows that we can do a better service for them and it's the right timing, that's probably the answer right there. There's nothing that makes us so much special and better than anybody else. It's just getting in there. Maybe timing is the best thing. Right. So, but hopefully there's another in and out that we can help them with. We don't want to help them. Maybe if they do ask, say, hey, we want to do this, but you guys can look at see our specimens until we get our lab up and running. Can you help us out with that? We're not in the business to help another clinic out like that. We want to make sure that we handle everything for them, because sometimes the doctors want you to help them out and get their lab up and running at their location, and we don't want to do that. So I'm going off on a tangent there. So
is it are doctors likely to use more than one path lab? Is that common?
Not really, Mike. That's another good question. They want to stick with one, so they're happy with one. They're usually happy with a lot of path labs that they have chosen in the past because of the relationship with the pathologist they have and the sales reps that make the connection with the doctor or the clinic. But I have never seen in my line of work, I have never seen them choose two different labs unless they're just very, very busy and that lab has an overflow lab. So.
Right. And once a doctor decides to go ahead with your solution, how quick can they be up and running?
That's a good question. Usually they'll sign a doctor's acknowledgement form that they're ready to use us, that we can bill their patient's insurance after they send us specimens within a few days. We can send them out shipping supplies and the formaldehyde jars and all that and the reg forms, and they should be within 2 days. We'll have all that taken care of.
Right. And the insurances?
We usually are 100% with all the insurances nationwide, Medicaid, Medicare. Some states are kind of different with the Medicaid, just depends. Mm-hmm. But those are a few states. We try to stay away from the states of New York, Pennsylvania, Massachusetts, and what's the other one that we had?
It's kind of all in that northeast.
Yeah, the north. Yeah, there you go. Yeah. And Connecticut. Mm-hmm. So they have a little bit of hard times with the Medicaid and some of the Blue Cross Blue Shield Blue plans.
Right.
So basically, if you got a funny accent, you're out of business.
True. If you can't understand what they're saying.
Does that mean I get ejected from the program now?
We can understand you.
Well, Blaine,
go ahead. I'm just saying, it just depends on some of the insurances. Blue Cross Blue Shield nationwide is a pain for anybody really in the tox and the pathology field, because Blue Cross Blue Shield caters to Quest and LabCorp. But we still get around in the pathology side. Blue Cross Blue Shield will pay some of the claims on those, but most of them are Medicare because of a lot of older people, that are out in the sun. The big states for us is Colorado is a big one because we're a mile high, closer to the sun, and we get a lot of skin cancer here. And any of the sunny states that, there's tons of them nationwide. And there's still a lot of them, Nebraska or Kansas, they still have them. So I'm not trying to rule all those guys out, but Medicare is the biggest thing that we want to try to go after. Medicaid it's okay. But private insurance is another big thing too that we're okay with. But where we are credentialed and contracted with some of the insurances nationwide, most of them. So we will get paid most of the time. So.
Blaine, I want to thank you for this great information. Thank you for getting on. We'd love to have you on again. And this is another one of those areas that I've not seen people focus, because for the majority of the time there's not a clear revenue model for the doctor. This really just comes down to service and relationships at the end of the day. So this is a great sale. Especially if you have a relationship with a doctor, this is a great steady business. I mean, I was really shocked to see some of the numbers in pathology and to see how steady of a business it really is. So Blaine, I want to thank you for getting on, and Viv, thank you for going all the way out there to see Blaine. We're We're gonna
Is there
get we're gonna get
I've
an
got to fly back
ancillary. We're buying you an ancillary podcast airstream, and Viv is gonna tour the country and go city to city and conduct these interviews. So Viv, thank you for volunteering to do that.
Excellent. Well, next time I come out here, can you make sure it's snowing? Because then I can go skiing as well.
Hey, it's sunny today, so that's a good thing.
Yeah.
But hey, stay around for 10 minutes; it might change. But hey, I want to say thank you very much, Mike and Vivian, for letting me even talk to you guys and then getting it out there for us.
All right. Thank you, everyone. We'll see you on the next show.
Thanks for your time.